Hi, I'm here with Simon Williams, Advanced Paramedic with Cornwall 111, and we're just going to chat a bit more about the service and what it offers for our patients in Cornwall. Right, Si, thank you for making time to come and speak with us.
Thank you for inviting me, Rob.
So firstly, could you just tell us a bit more about your background and how you came into the role with 111?
Well, thanks. So I've been a paramedic in the, initially in the Cornwall Ambulance Service and its other iterations for the last 35 years. I was privileged to be involved with the development of the air ambulance, the paramedic training skills and the degree pathway. So I was fortunate to have a conversation with the Chief Operating Officer, and I came to 111 to solve a problem really with ED validations.
And what's your role within the service?
So my role as an advanced paramedic is to re-signpost the 111 calls that have originally been identified as an ambulance validation or an ED validation. I can then take a fresh look at the call, and we in Cornwall have the ability to re-signpost these patients to a service that's more commensurate with their need, thus easing the burden on ED and the ambulance service.
Okay, so it's making best use of the resources we've got in the county and giving patients the right care.
Absolutely. It's important to recognise that Cornwall functions best with all its services integrated and working as one.
Perfect. Okay, so I mostly come across and use the 111 phrase, so to speak, in my consultations when I'm making a safety net to close a consultation, and using, if you deteriorate over the weekend or out of hours, call 111 for further advice. And could you just talk us through maybe the pathways or the patient experience that would happen if they chose to do that out of hours?
Yes, indeed. So should a patient have any queries, any questions, or become concerned after seeing yourself and your colleagues, then we're able to, the call will go into 111 and it'll be taken initially screened at a call centre following a computer algorithm. If the call is identified as having either an ED validation or an ambulance validation, it then comes through to us and is identified as such. We can then contact the patient and see if there's a more appropriate service that meets their needs, or indeed if they do need to go to ED, or if they do need an ambulance. Equally, it may well be screened that they just need further advice or a script update, or they have some other issue, and that can be met with the rest of the clinicians that are available that operate the service 24 hours a day, 7 days a week.
Yeah, and those contacts then get communicated back to the GP, don't they? The primary care.
That's right. That's right. As the contact is emailed back to the practice, usually within 24 hours.
Brilliant. So I think that's quite important to recognise, isn't it, that actually within the calling the 111 service, it's very much not limited. There's a whole scope of urgent care and out of hours practitioners available to you through accessing that one short number.
Absolutely, it really is very successful, and I think it's certainly fit for purpose. By dialing 111, you can be tracked to the service that best meets your need at the time. I find a useful adjunct that I have I use on a daily basis is the NHS Service Finder, which is it's an app for clinicians where we can not only support the patient by advice over the telephone, but by using their email address or their mobile phone, we can then email the services such as address, phone number and opening hours to the patient themselves for them to take away.
That's really proactive and very interactive.
Absolutely.
Okay, so I suppose what we've learned from the conversation is that there are very experienced clinicians on the end of the phone to deal with our patients out of hours, such as yourselves, and you can signpost them to a vast array of services that are available out of hours, and that improves outcomes for patients and efficiencies in the health system.
Yep, absolutely.
Yeah. Okay, thanks for making time, Simon.
My pleasure.
Take care.
Take care, everybody.